the dashboard for Parkinson is something that we've recently published, and it is a dashboard of 5 different, what we call the 5 vitals of Parkinson. And the vitals are motor symptoms, non-motor symptoms as a whole, then gut, vision, and oral health, bone health, and then finally co-medications and co-morbidities. And by doing so, what we mean is some basics that must be done in everybody with Parkinson. And the dashboard is a prompt to help the busy clinicians who may not be experts to do that in the clinic. And it's been widely endorsed by the patients. And for instance, many patients we find that bone health is not addressed, although we know that 2 in 5 women and 1 in 6 men over the age of 50 have osteoporosis. Such patients must have their bones examined because otherwise they carry a serious risk of fractures if they fall. Similarly, many patients on Parkinson's who might be on dopamine agonist drugs might be falling asleep while swimming, while driving. This is a hazard to their own health, even can cause fatalities. So looking for a history of sudden onset of sleep is very important, and the occupation of the patient. Similarly, we know that diabetes might have adverse effect on Parkinson. We know that if you've got cognitive problems, you should not be given anticholinergic drugs. So these are all flagged up in the dashboard so that when the patient comes to see the clinician looks at the dashboard. In future, we want to have this as an app, and then it ticks, okay, have I done this, have I done this, have I looked at the bone health? Another example, Helicobacter pylori, infection of the stomach, controversial, but still can delay absorption of levodopa. It can be easily diagnosed and treated. So when somebody is saying the levodopa is not working very well, have you checked the Helicobacter pylori and have you treated that, etc. So this is all integrated into the dashboard, and we very much hope that it'll become incorporated in the pathway of care for Parkinson.